Thank you for letting us discuss our findings on social deprivation index and emergency department visits that don't require readmission. Again, do not have any disclosures. Social determinants of health have a substantial impact on a patient's health, well-being, and especially their quality of life. Social determinants of health include where a patient lives, their social community, economic stability, education access and quality of that education, as well as their access to healthcare and having high-quality healthcare. Social disparities have been associated with decreased access to healthcare, healthy living options, as well as transportation options. Traditionally, socioeconomic status has been used in evaluating surgical outcomes by income quartile and insurance type. This is really only one metric, though. Low socioeconomic status has also been associated with decreased access to EGS care, worse postoperative outcomes, increased mortality, as well as increased healthcare expenditure. More recently, social deprivation index has been used as a more nuanced assessment of socioeconomic status. Social deprivation index encompasses poverty rate, education level, employment rate, percent of single-parent homes, percent of those living in rented housing, and percent in overcrowded living, and percent of households without a car. These scores are calculated based off of a patient's zip code and is given a cumulative score of 0 to 100, 100 having the most deprivation. Traditional outcomes in surgery often look at readmission rates. However, healthcare utilization, such as ED visits that do not require readmission, are not well understood. These visits represent important healthcare resource utilization that increases the demand on an already strained system. So our goal was to evaluate ED visits that were not requiring readmission for those undergoing low-risk surgery, which included urgent appendectomies and cholecystectomies. Our hypothesis was that patients with higher SDI will have an increased 90-day non-readmission ED visits. So we collected adult EGS patients who underwent Emergen or urgent appendectomy or cholecystectomy from January of 2022 to September of 2023 at one of our 9 hospitals within our region. Patients had at least one of the ICD-10 codes listed to the left. We collected patient data and demographics, including insurance type, Charleston Comorbidity Index, ASA score, and ASA scores. For their social deprivation index, these patients had composite scores and were placed into quartiles to evaluate healthcare disparities. Our primary outcome was 90-day non-readmission ED visits, and secondary outcomes were index length of stay as well as 90-day readmissions. So we then performed a univariate chi-squared analysis as well as a univariate and multivariate logistic regression evaluating SDI by quartile and NAED visits. We controlled for insurance status, age, CCI, and ASA score. In total, 5,336 patients were identified. Those with NAED visits were more likely to be younger, female, Black, and have Medicaid insurance. Here's a breakdown of our composite SDI scores. We had a disproportionate amount of patients between 51 and 75. Here you can see our initial admission diagnoses and whether these patients had no postoperative visits, an NAED visit, or a readmission. Those undergoing cholecystectomies had significantly higher rates of NAED visits and readmission. For those with NAED visits, looking at quartiles, in quartiles 3 and 4 had a statistically higher rates of NAED visits. In length of stay, readmissions had the longest length of stay. However, those with NAED visits followed closely behind. Looking at our univariate regression analysis, those in quartiles 3 and quartiles 4 had a 35% and 33% higher odds of having a non-admission ED visit. And adjusting for age, insurance, CCI, and ASA scores, higher SDI scores continue to have significantly higher odds of undergoing a non-readmission ED visit. So in conclusion, patients with a higher SDI were up to 35% more likely to have an ED visit not requiring readmission after a low-risk surgery. And NA-admission ED visits are an opportunity to target in order to decrease healthcare spending and utilization, especially in patients with higher SDI. Thank you. I'll take any questions.